owners struggle so much to just find someone that's willing to see them so that by the time they get to someone, they're like, listen, do whatever you can, whatever it takes, because they're just so grateful to have found someone that's willing to work on them. Plus, most people at least that I work with, they see their pet as like a dog or a cat owner would see them. Their pigs are their companion animal, and they're willing to invest in, preventative care or routine care for them in order to have them with them as long as possible.
Hi, guys, and welcome to the House Call Vet Cafe podcast. I'm Dr. Eve Harrison. I'm a full-time integrative concierge house call veterinarian in Los Angeles, and I help other vets to build their unique mobile practices on their terms. This podcast is for and by house call and mobile veterinarians, so it is meant to give our community a platform to connect, to share our stories, to lift each other up, and to support each other. Most of us work solo as lone wolves, right? So for me, it's been really powerful to be able to physically hear the voices of my colleagues from all over the world and to get a chance to feel that we truly are part of a community of very real other human beings who get it. While you may be alone in that little bubble of your own vehicle when you're on the road seeing patients, I welcome you to join our community by tuning into our own podcast when you're on your way to your next house call. Whether you're a super experienced house call vet with 30 years of experience, you're a brand new prospective house call vet just looking to get started, or you're house call curious, there will be something for you in this podcast. Each episode, you will hear interviews from other mobile veterinarians just like yourself who are doing unique and innovative things, vets who are sharing their stories, their struggles and challenges, and you can also look forward to hearing valuable information and perspectives from specialists and experts outside of our micro niche. And finally, if becoming a house call veterinarian is something that you've been thinking about exploring, or you're looking for some extra support getting your own mobile practice to feel more profitable and sustainable for you, check out the information in the show notes about my course and our above and beyond supportive private community for members only, plus our monthly group coaching sessions within the House Call Vet Academy. You can also check out my free public Facebook group, which is also called the House Call Vet Cafe, the same name as this podcast, and which is a warm and cozy community for mobile vets to support each other in professional and personal development, in creative entrepreneurship, and in friendship. So thank you guys for spending time with me today. Let's dive into the episode. Okay, everyone, we have a super fun guest today with us. We have Dr. Bridget Breslin with us, who is the Piggy Clinic on Instagram. And I just had to reach out. I was like, dear God, this is a cool person. So we're going to go into a little bit more about why she is the Piggy Clinic. But Dr. Bridget Breslin grew up in Westchester County, New York, very close to where I grew up, Riverdale, New York, in the Bronx.
Oh my God.
Yes.
Yeah.
And she made her way to the Midwest during undergrad, where she attended Purdue University. At Purdue, she obtained a degree in animal sciences, and following graduation, she landed in Ohio for veterinary school at The Ohio State University. She graduated from there in May 2022. Congrats!
Thanks. I can't believe it's almost been a year.
Amazing. I'm so proud of you. You like kicking ass and doing great things. So she graduated in 2022 with her doctorate in veterinary medicine. She's now currently working at Fulton Animal Hospital in Canal, Fulton, Ohio, as well as serving on the board of Pig Placement Network. She's very passionate about caring for pigs, just as dogs and cats would be cared for. Companion animals is how she sees the pigs, which is wonderful. She has an Instagram account called the Piggy Clinic, which again is what caught my eye and made me want to reach out. And she does have a pig named Penelope and a dog named Sophie. So welcome. It's so good to have you here, Dr. Bridget.
Thank you so much for having me.
You're welcome. So kind of before I dive into our interview, I had to get this little piggy background here for anyone who's watching on the YouTube version of this. This is a pig on Pig Beach in the Barbados. Have you heard of Pig Beach?
I've been there.
You have? Oh my God. Tell us about it.
I went when I was in college with my mom. She was like, let's do it. And I was like, oh my God, absolutely. It's really fun. People don't necessarily understand that they're like wild pigs.
Oh, okay.
So, I mean, they're like interactive with you, but they're also like very guarded. They're great, but some people will tell you that they like try to chase after you or something of that nature. They're really not bad. They just are pigs that don't know what they're doing.
That's hilarious. I looked up so for people who are just listening and not looking at the YouTube version, my Zoom background screen is a pig in like swimming, and you can kind of see like the underwater. So you can see his little hoofs like swimming in the water and his little snout or her little snout sticking up over the top. It's like really, really cute. And I was like, oh my God, tell me more about this pig beach. And I Googled it, and, one of the Sandals websites came up and they said, as you would expect with creatures so wildly adorable, the famous swimming pigs of the Bahamas have gained much internet fame over the years. So it's just like so cool. What does it say here? It says the pigs reside on various islands in this territory, including Eleuthera, Rose Island, Abaco, and Ship Channel Key. Oh yeah, they say Key. But the main island where you can find swimming pigs in the Bahama is the Big Major Key. The pigs on the Big Major Key or the Pig Islands are the original swimming pigs of the Bahamas, and there are about 20 pigs on the islands and piglets on the island as well. So cool. That's
It's really cool. I highly recommend checking it out.
They say they also made an appearance, these pigs, in The Bachelor.
Oh, yeah, they did. They, like, went there at one of the seasons. I used to watch it all the time.
So that's amazing. Of course you've been there. I was like, I have a sneaking suspicion you'll know what it is. And I was like, even better if she's been there. That's so
Yeah.
cool. Okay, I'm gonna have to we're gonna have to talk about this after we finish recording because I want to go now. That's
Absolutely.
amazing. Oh, my dear, can you tell me when you're on your way to see the piggies or you're on your way to work, what is your favorite snack to eat in the car?
Ooh.
You have a truck?
I do not have a truck. I wish I had a truck, but I
Someday.
don't. I just use my car. But I love protein bars. I'm
Okay.
always eating protein bars, but I also am a sucker for anything chips or pretzels. So I probably am eating those as well.
Nice. So you're into the crunchy, salty stuff.
Oh, yeah,
Yeah.
absolutely.
I'm envisioning you. It's probably not true, but I'm envisioning you in a pink car, like a piggy pink car, eating your crunchy, salty things.
Yes. I wish I was in a pink car and they had like, like when during this holidays, like people put like antlers or something like
Yeah.
cute on their car. Like I
Yeah.
want pig ears and a pigtail.
Oh
That's
my
what I
God.
want
And a
for
pig
me.
snout. Okay, we have to raise some funds to get your car wrapped, like so that it's like a pig and like a snout and ears and a tail. Oh my God. It's so cute. I love it. So
I
cute.
definitely draw attention.
I bet. I bet. Oh my gosh. That's so cute. And then when you honk your horn, it would be like an oink.
Oh my God.
So can you tell me a little bit about how you got into practicing on pigs? I'm getting a little ahead of myself here. I love what you do, and I wanna hear a little bit more about how that evolved. I know it
Yeah.
from what you told me, it started from when you were very young.
Yeah, yeah. So I've always been slightly obsessed with pigs. And growing up in New York, my parents thought I was insane because I always wanted a pet pig. And as I was telling you, like it started really in second grade. I like became obsessed for some reason and then just didn't lose it. And I always wanted to be a vet. So I didn't really have a lot of experience with like pigs in the vet world because where I grew up, it was just mostly dogs and cats.
Yeah.
So that is when most of my experience had come from. But when I got to Purdue, I started helping out more with like production pig medicine, which by all means is a necessary, field. And I applaud all of the vets that do that work. It just wasn't for me.
Mhm.
I was more, stuck in my small animal practice ways, but also wanted to incorporate that into pig medicine. And when I got to vet school, I actually met a vet student that was 2 years older than I was. And she also was in the pet pig medicine field. And she helped me a lot in getting like, relationships formed and just helping me like, figure out what it meant to be a pet pig vet rather than doing like production pig medicine. And then I think when things really took off was my fourth year. I did an externship with her name's Dr. Mazzacchio. She actually wrote a book on pet pig medicine. And so she like took me under her wing and literally we had like a 2-week crash course on everything pet pig medicine. And then she invited me back like several other times. So we've grown very close together. But she's been a huge influence on how I practice and things I've picked up from her, I probably wouldn't have picked up on. So I'm very grateful for that.
Oh, that's wonderful. I love that you had mentorship from even student colleagues and then the doctor who wrote the Pet Pig book. And we'll link that book in the show notes because I think that's really cool that such a book exists and I didn't even know about it. So that's really, really cool that you formed that kind of connection and, mentee mentorship relationship. That's very, very cool. I love that.
Yeah, yeah, it's very fantastic to have. I would highly recommend it to anyone, like even someone that's a year older than you, like finding someone that's in the same interest as you is huge.
Especially in such a narrow niche like that. There's classes in school on like pet pig medicine, right? Like, I mean, if there were, I didn't take them, but I don't recall anything like that. And so
No.
that kind of one-to-one mentorship and following in the shoes or, getting, so you don't have to learn all the lessons the hard way, I think is so important. And I
Yeah.
think it's just wonderful. Like the apprenticeship model is really, really important for the things that we do as veterinarians, I think.
Yeah. Yeah,
Yeah.
absolutely. But then, when I got out into the real world, I pretty much, when I was like applying for jobs, I knew I wanted to see pet pigs and I knew it would have to be a conversation with any clinic that I applied to because most people just think of them as just screaming animals that they're not easy to work with and all this other stuff. So when I applied, that was like the first thing that I, discussed and how I was passionate about it, et cetera. And so I found Fulton Animal Hospital and they have been wonderful with me in terms of, allowing me to grow that side of my practice.
That's so cool. And
Yeah.
so, yeah, so it sounds like you are incredibly passionate about being able to treat pigs like we would treat any other companion animal. What did the hospital say, when you introduced that idea? Is there a demand? Are you seeing, like, how many pigs are you seeing a week or a day? And, what is the general kind of public pig owning population like?
Yeah. So I think it varies greatly in what area you're from. Like there's certain areas that I would say are more well populated with pigs than others. Up near me, there is a good population of pet pigs. There's actually a couple breeders within the area that breed pet pigs. So people will adopt them and then need vet care, which is great for me. It has been a little bit slow growing to begin with, which I understand. Obviously, going in expectations, I was like, oh, yeah, I'm going to have thousands of pigs coming for me. But like, no, that's not realistic. But anyway, I am still seeing a fair amount of pigs. I probably put it at one a week.
It's pretty good.
And yeah, and coming in for all various reasons. Some are able to come directly into the clinic, and then others I do house calls just because transportation's not an option or just ease on the owner's aspect of things.
Very, very cool. Yeah.
Yeah.
So you do house calls through your clinic. And I know you mentioned you also volunteer with the Ross Mill Farm and do kind of pig calls through
Yeah.
that. And I know you also had mentioned the piggy clinic was meant originally to be like your own business and it doesn't exist yet, but maybe in the future. So maybe
Yes.
it'll be strictly like a piggy house call practice, which is like the best thing I've ever heard of in my entire life. I would personally pay for your vehicle to get wrapped like a piggy if you do this. So I'm like so rooting for you, like so excited for this. So yeah, tell me a little bit about what it's like to do house calls for pigs.
Oh gosh, it's definitely an experience. Most of the time I ask for them to be in somewhat of a fenced in or secluded area, even if some pigs are in their house when I go to visit them. So I ask them to put them, in an area that can be closed off because they will just run away from you immediately. And then you spend most of your time trying to chase them. And most of what I do is I will flip the pigs in terms of, getting handling on them. There's a few other ways, some pigs are really tolerable and they will roll over for a belly rub and I can do an exam that way. Others, even if they get rolled on their back, they're not tolerating it. So I would have to sedate them. And then there's a really cool device called a Panapinto sling. It's like a sling that goes on a crank. It lowers all the way down to the floor and a pig can walk on it. And
Oh,
then there's like armholes and leg holes so that they can't obviously get out of it. And then you crank it up and then you can work right under them. You can do your physical exam. they're great. I've worked with one at Ross Mill Farms. I personally do not have one because they are expensive, but it's also a great tool. Like if you're getting into the pet pig thing, definitely recommend, being in contact with someone that has one or getting one yourself. So those are kind of different tools I use to help restrain pigs. And then majority is, physical exam or a lot of skin issues with pigs. So we tend to see a lot of that. Hoof and tusk trim is a big one. Now they're called mini pig farriers. So sort of like horse farriers, but they only do mini pigs. And so I've utilized a lot of their services for things like hoof trims because some pigs will need them way more frequently than others. And so they're a great service to have, available to owners because they'll come right to your house and kind of do the whole house call thing there. And then what else do I do? Vaccines, stuff like that. Usually it goes pretty smoothly. There's always, the ones that will make you work for it. But most of the time, owners are really grateful, to have someone able to come to them because transportation is usually the biggest factor in trying to get them into the clinic.
Yeah. Oh, that's so interesting. Okay, so what do you do about the screaming? Like do you wear earplugs and stuff? Like
I probably should be wearing earplugs, although I don't. I usually
okay.
have them with me, and then I just never remember to actually
Yeah.
put them physically in my ears.
Yeah.
People I work with do put them in, like my technicians and assistants, they will put them in because they don't like the screaming. They're not as tolerable as I am to it, which is totally understandable. If they're screaming and they are pretty much like uncontrollable, what you can do, one like cool tip that I learned actually from Dr. Mazzacchio is doing intranasal midazolam.
Oh.
So yeah, so you can actually squirt it just right up their nose and it takes effect within like a minute and they are completely asleep. And then they usually wake up and they're like with it enough to like get on their feet and walk out, but they're still, a little bit woozy. But
What
that works great to help
kind
with
of dose what kind of dose do you do if you know off the top of your head?
it
You don't
depends
have
on the size of the pig. Usually half a cc to 1 cc is usually sufficient enough to get them to be calm.
oh,
Yeah. Other things, if I know going into it, like if I've seen the pig before and I know that they're a screamer, sometimes I'll prescribe things like trazodone or gabapentin, which I know are not always FARAD approved, but they do really work in pet pigs. They are great tools to have if you know already that the pig is just anxious in general and kind of like a dog or a cat, prescribing it, 2 hours before you get there is sufficient enough. And I usually just use like the bad dog cocktail type of thing where it's, the dog dosages that you would use. And then third option is usually sedation for them. I try to avoid sedation as much as I can, just because pigs I find and I don't exactly know the reason. It could be, their fat depots that they just hold on to the drugs a lot longer than other species. And so I try to avoid them as much as possible. Some pigs, even with sedation, they need things like gas anesthesia in order to stay down. I know there's practices out there that will gas everything down. I try to avoid it as much as possible.
Yeah, I like a conservative approach myself just for all of veterinary medicine in general, so I'm with you on that.
Yeah.
So you obviously know there's the thing about giving pigs Guinness to sedate them. Have you given pigs Guinness beer before?
I have not, although I've had owners that have done it before I've gotten there and then they are like, "Oh yeah, I did that." And I'm like, "Okay." It does have an effect, I have to say that.
Mhm.
Um, I don't prescribe it as like a means to keeping them calm.
I mean,
Um,
technically it's off label, I would imagine, right?
yeah, yeah, but people do it. It does work, but again, some pigs, their stress level, they're, all flight, and so they just, fight right through that stuff and still need additional support.
Mhm. And there's all different types of clients out there. And, like people with exotics just tend not to want to pay for the care. But people with birds are like, they'll pay anything. Same with rabbits. They'll just like whatever you need to do it. What are pig people like? Are they resistant to paying for veterinary care? Or are they more like the rabbit people where they're like, "Doc, do whatever it takes," that kind of thing.
They are definitely along the lines of doc, do whatever it takes. I was surprised by that when I first started. And I think the reasoning behind it is so many people are reluctant to see pet pigs that owners struggle so much to just find someone that's willing to see them so that by the time they get to someone, they're like, listen, do whatever you can, whatever it takes, because they're just so grateful to have found someone that's willing to work on them. Plus, most people at least that I work with, they see their pet as like a dog or a cat owner would see them. Their pigs are their companion animal and they're willing to invest in, preventative care or routine care for them in order to have them with them as long as possible.
That's amazing. So, another kind of clinical question for you. I know it's a little bit taboo to talk about end of life and, euthanasia kind of on the air in public, I guess, but we're in a group of veterinarians and this is what we do. And a lot of us house call vets are doing, only euthanasia, right? And
Yeah.
so this comes up periodically, like, I don't know, every few months, someone who normally does end of life care in the home for cats and dogs will say, "Oh my God, there's a pig that needs, a humane euthanasia. How do I proceed?" Guinness always comes up, the beers, to sedate them. But I want to know from your experienced perspective, what is kind of your recommended protocol to make sure that a pig who's having an in-home euthanasia has this peaceful, comfortable, easy passing that just makes it safe for everyone involved? How do you kind of navigate that?
Yeah. That's a good question. I typically will sedate them in some form. It honestly depends on how the pig is looking, on what sedation protocol I go for. Things like dextromethorphan, midazolam, butorphanol, all of the small animal drugs can be used in pigs. And if you want, I have like dosages that I
Yeah.
could
Yeah.
send over to you or
Yeah.
share with everyone because
That would be amazing.
I certainly try to use things that I have on hand. One thing that I like to use for pigs is TKX. Some small animal practitioners will have that, others don't, but that does a good job as well in keeping them calm. If it's something that I know it's going to be stressful for them to even get sedated, I'll send pre drugs, like I said before, things like gabapentin, trazodone, even acepromazine over to them to just have given prior. Similarly, things like Benadryl and melatonin, kind of things that you would use for dogs to try to make them sleepy, also work in pigs. But yeah, anything I can do to keep them at least relaxed and calm as possible. I try my best, and every other vet should just try their best to get a vein on a pig. It's not always the easiest. My go to is usually the ear, but that could be easily blown. So there's other locations. There's actually one, they have what's called carpal glands, which are like three little glands that kind of sit right here, right here on your arm. Right adjacent to that, so kind of medial to that, there's a vein that runs down that way. So that's another one that kind of you blind stick it, but usually you can get it. So that's another good alternative. And then if I can't hit a vein, I go for the heart in most of these pigs. Similar to other people that do exotics, a heart stick is usually the easiest to get and inject the solution. For other things, if I can get them in an area that's comfortable for them, whether that's on a blanket, if they have something like a sling, putting them in a sling, if they're in their pig house, wherever they're comfortable is usually where I tend to leave them. And then what else?
And then your pre-med,
Um,
do you do that as an injectable or do you do that intranasal as well?
I do it as an injectable just because I find it a little bit easier to do it that way. It's a little bit more effective in the long term to keep them like completely still. And then other things I would do, people do like dog or cat, like paw prints or nose prints. I do a snout print for pigs so that the owner has something that they can have with them. Some people will like to, similar with horses, cut a piece and keep the hair on the tail. And so
Yeah.
I'll do that as well. But those are just kind of little other tidbits that I do for euthanasia. But injectable sedation first, and then IV euthanol is usually what I use. And then in terms of injectable, IM is ideal. Sometimes it goes, I call intra-pig. It just goes in there. It usually will make its course through the body, but it does take a little bit longer if you don't have a long enough needle and it just goes in their fat.
Yeah, yeah. Well, thank you for sharing your protocols for how you do that. That sounds very peaceful and respectful to the pigs and the owners. And I love that you do a little snout print. That's amazing.
Yeah. Yeah.
So shifting gears away from depressing pig euthanasia, we had to cover it. Can you tell me a little bit about what types of pigs you see? I know you had done a post about mini pigs and the difference between mini pigs and other kinds of pigs. And yeah, just
Yeah.
it's about what kinds of pigs are you seeing in the home?
So majority of the pigs are of potbelly pig descent. That's actually the only breed that's recognized as a pig breed for at least the pet pig population. There are some people that have pet Cooney coons, which they are a meat breed in some areas of the world, not particularly in the United States. They're really cute. They're usually the ones that look kind of like the picture you have in the back, where they're more brown and black in coloration. And they have these things called wattles that help with like location and sensory stuff. But they are some breeds that people will have, or mixtures of them people will have. They do get much bigger than the traditional like potbelly pigs. So they're closer to getting up to like 400 pounds versus potbelly pigs or mini pigs are classified as under 300 pounds. So most of what I see are of a potbelly pig descent. There are people that will argue things like Julianas are a breed. They're actually more of a coloration, but they do, I have to say, have a personality of themselves. They tend to be a little bit more energetic or sassy in nature
Oh,
compared to
sassy pigs.
yeah, compared to
Cute.
some of the others. So I have to say, yes, they're a coloration in terms of classification, but they definitely have their own personality. And then there's a couple of breeds that are used that I posted about that are used more for like research purposes. There's Gottingen pigs. There's actually a woman on Instagram, and you may have seen her because they post all the time, but they have like 5 of them, Gottingen pigs. And they go to things like Disneyland, and she dresses all 5 of them up. They're so cute. She dresses them up for like all different holidays. They post videos all the time. I'm like, oh my God, I wish I had 5 Gottingen pigs that were like that just are so tolerable of everything. But then there's breeds like that are used predominantly for research purposes. But those are like the Coonies, the potbelly pigs, and then Julianas, I would say, are predominantly, of what I see for a mixture of some sort within that. And it's Vietnamese potbelly pig is the actual descendant of all the mixed potbelly pigs.
That's amazing. So is your pig Penelope? Is she a Vietnamese potbelly pig descendant?
Yes, she is. I actually got her from my brother's friend in college. She had purchased her from a breeder and then brought her back to college with her. And her landlord was like, absolutely not. And so she tried to pass it off to a couple of people to watch or keep during the school year. And she really couldn't find anyone. And of course, my brother was like, oh, yeah, no worries. My sister will take her. So that's how I ended up with her. I'm very thankful that I did because I love her. But yeah, so she is of a potbelly pig descendant. She came from a breeder in South Carolina. And she's not very big. She only weighs about 77 pounds. So I always describe her as like a corgi. She's really low to the ground, but very pot belly.
Is she a baby or is she full grown at 70?
She's full grown. She is 5. So she is an adult now. But I thought she was going to get much bigger. So I'm
Yeah.
slightly grateful that she's only 77 pounds.
How does she get along with your dog?
Oh, they love each other. Yeah, my dog was a foster fail,
Yeah.
of course. Yeah, I got her as a puppy, actually, and Penelope was, like, a year and a half when I got her, so I joke all the time, but I really am kinda serious in this, that I think my dog thinks she's a pig, um, and the
So
reason I
cute.
say that is because she will go outside and like root her nose like a pig. I recently was watching a piglet and my dog thought she gave birth to the piglet. Um, and so sometimes I'm like, I think your identity is a little bit skewed right now. Like you do not look at them. And sometimes she plays with other dogs and is like really confused. And I'm like, that's you're a pig.
You're a very furry pig.
Yeah.
Does your pig think that she's a dog?
No, absolutely not. She
So
knows
she's
she's a
like
pig.
pig through and through.
Yeah, she was like a full pig. And my dog is just very confused. But honestly,
Cute.
I think it works because they get along great.
That's absolutely amazing. I love it. Before we got on the recording, you were telling me a little bit about how the latest kind of medical adventure that Penelope had.
Yeah. So I woke up one day to notice that my pig Penelope had petechia head to toe, which are small little, like almost bruise looking lesions all over the body. It was actually my boyfriend that first noticed she had urinated blood and he was feeding her and he was like, well, she's otherwise acting normal, but like you should probably go down and look. So I went and looked at her and I was like, you didn't notice that she is covered in petechia? And he was like, no. I was like, okay, great. Um, so I immediately like rushed her down to OSU only because one was in surgery that day. So I knew I couldn't take on her case as well. But also, I knew she needed further diagnostics than what I had available to me. So I brought her to OSU and they did a great job with her. They did the whole 9 yards, CT scan, blood work, etc. And pretty much she got diagnosed with immune mediated thrombocytopenia, which actually has only been reported in the Gottingen pigs that I was talking about previously. It's never, to my knowledge or to the internet's knowledge, been reported in a potbelly pig. But I presume it's probably happened before. My pig is probably not the first case of this, but
Well,
it's
write it up.
interesting. Yeah, it's interesting. I know. I was like, once she's 100% better, I'm absolutely writing
Yeah.
this up as a
So
case
not to
study.
jinx it. Yeah.
Yeah, yeah. But she wasn't on any medications, no history or no evidence of anything like cancer, which was my biggest concern. No infections, like nothing. Like it was just all immune mediated. And she was started on prednisone and she's done great. She started off with like one platelet.
Oh,
They even,
oh my
yeah,
God.
they like sent it out down to the clinical pathology lab and they were like, we're mistaken, right? And they're like, No, you're not mistaken." And I was like, wonderful.
That's
She's
been freaking out so bad. Oh
yeah,
my God.
yeah. She is now within I think she's in the 200,000 range, which is great. She made
Awesome.
market improvement.
Yeah.
But
Is that
yeah, it was
what is the normal range? Do you know off the top of your head the normal range of platelets for pigs?
it's usually like 400,000 plus. So
Okay.
she's getting there. Not there yet, but she scared me for sure because I was like, I don't know what's going on. And one of the things they thought about was things like rat poison. I was like, nope, there's nothing available to her that she could have gotten into. So it was a matter of just crossing everything else off. And then her response to Pred pretty much gave me my answer. But she's been doing well since. It took her about 2 weeks or so to completely clear the petechia.
Yeah.
And she had been in the hospital for 3 or 4 days just because they wanted to keep an eye on her, keep her on fluids, that sort of thing, which I was like, absolutely, please keep her. And she's been doing well since. I definitely noticed that she's perkier than what she was. And we had moved up here from Columbus. And so I attributed her kind of being more mellow to the move and an unfamiliar surrounding sort of thing, and not actually that something was going on. And then the other thing I've noticed that I brought up to Dr. Mazzacchio because I was like, have you ever seen this before? And she was like, I mean, I know they can change color. And I was like, well, me too. But like, this is just bizarre. And she even, like, I showed her pictures, like comparison photos, and she was like, whoa. I was like, yeah. So she was a grayish, like,
Mm.
she originally was more black with some pink in her. And then as she aged, she grew more kind of white in color and less black. So her pink really showed through more. And when we moved up here, I was like, wow, you're looking like gray, like not black anymore, gray. And I was like, well, she's getting a little bit older. I mean, she's still young, but like maybe age, maybe environment. I don't know, something of that nature. Since having her on Pred, she has gone back to being black.
Very interesting.
Yeah, like, and it's
Very interesting.
very, very evident. I, by accidentally, was trying to rub off a tuft of black hair because she had grown one,
Mhm.
like a witch's mole almost, at the corner of her mouth.
Whoa.
And I was like, "Oh my god, you got dirt on you." And I was, like, rubbing it, and it wasn't going away, and I was like, "Oh my god, I'm so sorry. That is a black tuft of hair that you've grown." I was like, "Well, now you have a good side at least."
It's so funny. Oh.
It honestly is remarkable. Like, I have been like, "Whoa," and, my boyfriend's noticed, other people, like, if they see comparison photos have noticed, like, I don't know what the underlying mechanism of that is, but it's very impressive when you see it.
That's so interesting. This is a completely different situation, but it sort of reminds me of a patient right now who was put on atopica primarily for perianal fistula. And this dog has had allergies, all along. And the allergies also went away. The fistula is healed, but my patient has become so incredibly furry. Like, not just like regrown hair from an alopecic skin. It was like there was normal fur, but
Hair.
now this dog is like looks like a bear. It's crazy.
Oh my
Just since
god.
starting the atopica. So I don't know. Don't know either what the mechanism of action of that might be. I'm sure there is one.
Yeah,
And
I'm
you
sure
can
there
tell
is.
me, but I don't know what it is. And it's just very, very interesting. It reminded me of my
Yeah.
in some way?
Yeah, that's
Mm.
very interesting.
Mhm. Highly curious. So, another question for you. Can you tell me a little bit about the Pig Placement Network? I'm really curious about what you do with that organization.
Yeah, so it's an organization that was started by a woman named Susan. Oh gosh, she's been in the pet pig world for years and years now. She originally was a potbelly pig breeder that as her and her husband's retirement plan, they decided to build Ross Mill Farm, which was actually their retirement enjoyment fund. And then from there, the Susan started what's called the Pet Pig Placement Network and Pig
Pet
Placement
Pig
Network.
Placement with Petekia Network.
Yeah, yeah, right. All the P's. Pig Placement Network is a nonprofit organization that dominantly what their goal is to provide education for owners as well as provide a space for pigs that need rehoming or pigs that need to be adopted. So it's kind of like Pet Finder, if you know that, for like
Yeah,
dogs and
yeah.
cats.
Uh-huh.
That's predominantly what it's used for, but for pigs and Ross Mill Farm, as well as, a few others will host the pigs that are a part of PPN network. So pigs that are adopted, they'll have a home there. Others will stay at whatever home they're at and kind of get adopted out from there, but it's a great resource that usually if pigs need to be surrendered, I offer, referring over to them because they are the best in terms of knowledge and rehoming these pigs. What I do is I am on the board of it and my position is education. So I do education in terms of client education, as well as kind of reaching out to vet schools, trying to teach students, prospective students, students that are in vet school, what it means to practice pet pig medicine, try to get them to learn more. Because even just knowing basics on pig behavior would take you a long way, even in an, ER situation where a pig comes in. Knowing just basic things can really help. And like you said previously, there's obviously a lack in education right now in terms of veterinary schools and teaching students not only just production medicine, but what it means to treat them as if they were a dog or a cat. So
Yeah,
that's what I do.
love that. That's amazing. I think there's
Yeah.
a lacking in vet school these days, including companion pig medicine. So brava. That's amazing that you're doing that. I'm really
Thank you.
you. I mean, you're
Thank
just
you.
like a year out of school and here you are going back and teaching things and, that's wonderful. That's really, really,
Yeah. Yeah. It's something I love to do. So it works out.
yeah, I can feel your passion. I can see how much it means to you. It's really, really cool. I love that you're giving back in that way. And before we kind of close up for the day, is there anything else that you'd like people to either know about you or any tips that you might have, kind of quick tips for anyone who might be interested in incorporating pig medicine into their house call or mobile practice?
Oh, I guess a tip for people that want to incorporate pigs is it's not as difficult as it seems. It can be very managed, in a very routine way. Getting people on board is going to be key because not everyone is as apt into working with pigs as others. But like I said, learning basics on behavior, I highly recommend Dr. Mazaki's book. It's like the only book out there that really is just pet pig medicine that is very inclusive, talks about behavior, talks about reproduction, spays and neuters, etc. And then what else? Always you can reach out to me. I'm very
Yeah.
happy to help. But yeah, no, it's not as scary as it seems. It can be very managed in an easy way. And if you don't want to work with pigs, try to find someone you know locally because I know a lot of people get calls all the time on where they can go to get a pet pig seen. So knowing people around you that are willing to see them is definitely helpful because people look for a very long time before they can find a vet that will actually see them.
That's great advice. Thank you for
Yeah.
that.
Yeah.
Very, very cool. All right. Well, it's been amazing talking about pigs and thank you for sharing your knowledge and your passion about pigs. And I'm really inspired and I'm like, oh my God, I need to go out and see some pigs. Ah.
Well, thank you so much for having me and having a platform to talk about this. It's been fun.
You're very welcome. And then finally, since we are in the House Call Vet Cafe, what is your favorite beverage?
Ooh. I'm definitely a coffee girl. Have you ever tried Death Wish coffee?
Death
Called
Wish
Death
coffee?
Wish? No.
No,
Yeah.
I
It's a
haven't.
brand. They sell it, at least they sell it at like the local like Giant Eagle, but it's out of think it's either upstate New York or Pennsylvania. It's one of the two. But it's highly caffeinated. So it's like above what your normal caffeine intake should be. But if you are a coffee lover that is trying to find more caffeine in their life and doesn't want to drink a whole bunch of coffee, highly recommend. It's also very tasty.
Amazing. I will look into it. That sounds really cool. Well, thank you again so much for being with us today, Bridget. And I look forward to seeing more pig content from the Piggy Clinic.
Yes, absolutely. Thank you so much.
Thank you so much for listening to this episode of the House Call Vet Cafe. If you enjoyed this episode, then hit the subscribe or follow button on Apple Podcasts, Spotify, Google Podcasts, YouTube, or wherever you listen to podcasts so you never have to miss an episode. This podcast is made specifically for you, so don't be shy if you'd like to reach out and let me know your thoughts on this episode. You can find me on Instagram and Facebook as The House Call Vet Academy, where I also share more valuable content. If you're interested in learning more about consulting for house call vets or the House Call Vet Academy online course and community, please click on the link in the show notes. Have an amazing rest of your day, and I can't wait for you to join us for our next episode of the House Call Vet Cafe.
If you're looking for help with ultrasound scanning, check out First Opinion Veterinary Ultrasound for independent machine reviews and online and in-person teaching options. FOVU, simplifying ultrasound.